7,000 years ago, a man is lying on the ground, fully conscious, while 4 other people pin him down by his arms and legs. Someone is about to cut a hole into his skull. On purpose, with a sharpened piece of stone. There is no anesthesia. There is no antiseptic. There is a very real chance he doesn't survive the next 10 minutes. And an even bigger chance he doesn't survive the infection that comes after, assuming he makes it that far. And yet, here's the part that should genuinely stop you. The bone around that wound would go on to heal. We know this because archaeologists dug up his skull. Smoothed, regrown, healed at the edges, like a scar made of bone. He lived. This is the story of how humans performed real, invasive, bloody surgery for thousands of years with absolutely nothing to numb the pain, and the increasingly unhinged methods they used to survive it, including one 19th century surgeon whose speed once caused a surgery to kill 3 people at the same time. Yes, 3. We'll get there. Here's what makes this story verifiable instead of speculative. Bone remembers everything. When a bone is cut and the person survives, it doesn't just stay damaged. It actively rebuilds itself, growing new smoothed tissue around the wound over the following weeks and months. That means archaeologists can look at an ancient skull with a surgical hole in it and tell, almost at a glance, whether that person walked away from the table or died on it. And the survival numbers are, frankly, shocking. Across sites in Peru, prehistoric France, and elsewhere, researchers have found trepanned skulls with deliberately cut openings, with healing rates estimated between 50 and over 80% in some ancient populations. Let that sink in. A skull, cut open, with a rock. Thousands of years before germ theory existed, and more than half the patients lived. Someone, somewhere, got terrifyingly good at this. Trepanation isn't some obscure footnote. It's one of the oldest, most widespread surgical procedures ever documented, with evidence stretching back at least 7,000 years. And some researchers argue it goes back considerably further than that. Archaeologists have recovered thousands of trepanned skulls across the planet, from ancient Peru to prehistoric Europe to parts of Africa and Asia, cultures with zero contact with each other, independently arriving at the exact same brutal solution. Why drill into someone's skull on purpose? To treat head injuries, to relieve dangerous pressure from skull fractures, and in plenty of cultures, to release what they believed were trapped evil spirits causing seizures or mental illness. Wrong theory? Completely wrong. But weirdly, sometimes the right result, because relieving pressure on a traumatized brain genuinely can help, even if the reasoning behind it was total mythology. Before we get into drugs and herbs, we need to talk about the real, unglamorous primary method, brute physical restraint. For most of surgical history, the most dependable form of pain management wasn't a substance at all. It was several strong people pinning the patient down, sometimes lashing limbs to a table with rope or leather straps, while the surgeon worked as fast as physically possible. This wasn't a lack of imagination. It was the best tool available. A patient who couldn't move, couldn't flinch at the exact wrong moment, and turn a dangerous procedure into a fatal one. Speed itself became a genuine surgical skill. Arguably, the single most important one. The faster the cut, the less total agony, and the lower the risk of the patient's body going into fatal shock from prolonged, unbearable trauma. Which brings us to one very specific, very unhinged surgeon we need to talk about. His name was Robert Liston, a 19th century Scottish surgeon, and he was, by all contemporary accounts, terrifyingly fast, reportedly able to amputate a leg in under 2.5 minutes, start to finish. In an era with no anesthesia, speed wasn't showing off. Speed was mercy. Faster surgery meant less time in agony and a genuinely higher survival rate, since prolonged trauma and blood loss were often more dangerous than the procedure itself. But Liston's speed occasionally outran his control, most infamously in an operation now darkly nicknamed the only surgery in history with a 300% mortality rate, moving so fast that he accidentally amputated his assistant's fingers along with the patient's leg and, according to the accounts, slashed a spectator's coat in the process, who reportedly died of shock, believing he'd been stabbed. The patient and the assistant both later died of infection. 3 deaths. 1 operation. That is genuinely how dangerous this era of medicine was. And Liston was considered one of the best in the world at it. If this feels familiar from an earlier episode about poisonous plants, good memory. The opium poppy shows back up here, and for good reason. Opium was one of humanity's most reliable pain relief tools for thousands of years, used across ancient Sumerian, Egyptian, and Greek medicine, specifically to blunt pain before and during procedures. The Ebers Papyrus, the same ancient Egyptian medical text we referenced before, describes opium-based preparations used medicinally as early as 1550 BCE. It wasn't precise. Dosing was inconsistent, effects varied wildly between individuals, and the line between enough to dull the pain and enough to stop breathing entirely was thin and poorly understood. But for a species with essentially nothing else, an imperfect tool that sometimes worked beat the alternative of nothing at all. Every single time. Then there's Mandrake, a plant with folklore so strange it claimed the root screamed when pulled from the ground. A scream so terrible it could kill anyone unlucky enough to hear it. Setting the folklore aside, Mandrake root genuinely does contain powerful sedative compounds. The ancient Greek physician Dioscorides, writing in the 1st century CE, specifically documented wine of mandragora, mandrake steeped in wine, used to induce a sleep-like state before surgery or cauterization. This wasn't nonsense herbalism dressed up as medicine. Modern pharmacology confirms mandrake contains genuinely potent compounds capable of causing real sedation, disorientation, and reduced pain sensitivity. The catch, as always with ancient medicine, the gap between a sedating dose and a fatal one was measured in guesswork, not milligrams. You were rolling dice with a plant that ancient people were so afraid of, they invented a killer scream just to keep people from touching it carelessly. Here's a story that sounds almost too good to be true, and might be exactly that, but it's worth telling regardless. In ancient China, around 200 CE, a physician named Hua Tuo is credited in historical records with developing mafei-san, a powder mixed with wine, believed to induce a deep, pain-free unconscious state that allowed him to perform abdominal surgeries that would otherwise have been unthinkable on a fully conscious patient. The exact formula was lost to history, and modern historians genuinely debate how much of Hua Tuo's story is documented medical fact versus near mythological embellishment. Ancient Chinese medical texts often blended real record with legendary reputation for celebrated physicians, but even purely as legend, the story reveals something real, entirely independent of Egyptian, Greek, or any Western tradition. Someone in ancient China was chasing the exact same impossible goal as everyone else on this list, a way to make the unbearable bearable. Not every method involved plants or drugs. Some cultures got physical, applying firm, sustained pressure directly onto nerves, particularly before amputations, could create temporary partial numbness in a limb, a crude, brutal precursor to the nerve-blocking local anesthetics used in modern medicine. Extreme cold, packing a limb in snow or ice where available, was also used to dull sensation before a procedure, a technique that persisted in various rougher forms well into more recent surgical history. None of these worked as well as real anesthesia, but layered together, restraint, herbal sedation, nerve compression, sheer inhuman speed. Ancient and pre-modern surgeons were assembling a genuinely resourceful, if horrifying, toolkit from every angle they had access to. We need to talk about teeth, because dental procedures might genuinely be the most horrifying entry on this entire list. Evidence of ancient dental work stretches back remarkably far. A site in Pakistan revealed drilled molars dated to roughly 9,000 years ago, using bow drills originally designed for woodworking, repurposed directly on living human teeth. No numbing, no shortcuts, just a rotating drill bit, a very determined patient, and presumably several people holding that patient very, very still. Ancient Egyptian and Greek texts describe tooth extraction using increasingly aggressive metal instruments, sometimes combined with the same herbal sedatives used in surgery, sometimes with nothing at all beyond gritted teeth and raw endurance. If trepanation makes you wince, dentistry from this era should make you want to lie down. Cauterization, using extreme heat, usually a heated metal instrument, to seal a wound or stop bleeding, sounds like it belongs in a torture chamber. It was, in fact, considered life-saving medicine for thousands of years. Ancient Egyptian, Greek, and later Islamic medical texts all describe cauterization in detail, used both to stop catastrophic bleeding and, they believed, to purify a wound of corrupting disease. The Greek physician Hippocrates is recorded advocating cauterization for a range of conditions, reportedly with a line often paraphrased as, "What medicine does not heal, the knife heals. What the knife does not heal, fire heals." In an era with no understanding of infection or sterilization, deliberately burning a wound shut occasionally worked better than leaving it open. Not because burning flesh is gentle, but because it was, brutally and unintentionally, a rough form of sterilization. Here's an angle almost nobody brings up when talking about unanesthetized medical history: childbirth. For the overwhelming majority of human history, childbirth was, functionally, major unanesthetized abdominal trauma, endured not by a small unlucky minority, but by nearly every woman who ever lived, often multiple times, with no pain relief beyond whatever herbal preparations her culture had access to, and often not even that. Maternal mortality rates across most of human history were staggering by modern standards, and the physical trauma involved in childbirth, even in births considered successful, was often severe and lasting. Some ancient cultures developed specific herbal preparations for labor specifically. The same opium and mandrake adjacent compounds we've already covered, deployed here too, with the same imprecise high-stakes guesswork involved. It's worth naming plainly, an enormous, quietly overlooked share of all unanesthetized human suffering across history happened here, to women in childbirth, largely absent from the more dramatic surgical stories that tend to get told. By the time we reach more organized hospital settings, an unusual architectural detail starts showing up, rooms specifically designed to contain sound. Early operating theaters, the term itself borrowed from the tiered viewing galleries where medical students would watch live surgeries, exactly like the one in Robert Liston's infamous three-death operation, were sometimes positioned deliberately away from patient recovery wards, specifically so the screaming from active surgery wouldn't be heard by other patients awaiting their own procedures. Think about the layer of psychological horror embedded in that detail. Hospital staff weren't just performing surgery without anesthesia, they were actively engineering the building around the fact that surgery without anesthesia produced screaming loud and frequent enough that architecture itself had to account for it. That's not a footnote. That's an entire era of medicine leaving fingerprints on how buildings were built. On October 16, 1846, at Massachusetts General Hospital, a dentist named William Morton administered ether to a patient before a surgeon removed a tumor from his neck. The patient felt nothing, remembered nothing, woke up on the other side of a real surgical procedure completely unaware it had even happened. In one afternoon, thousands of years of restraint, herbal guesswork, and raw surgical speed, as the primary tools of pain management, became instantly, permanently obsolete. Word of the demonstration spread across the medical world within weeks, an almost unheard-of pace for the era, because every single surgeon on the planet immediately understood exactly what they were looking at. It's hard to overstate how completely this one afternoon rewrote the entire remaining future of medicine. Everything on this list, the trepanation, Robert Liston's terrifying speed, the Mandrake, the fire, all of it, gone within a single generation, replaced by something that actually worked. Most of what we know about unanesthetized surgery comes from clinical records, bone evidence, and second-hand accounts. But one document stands apart, because it wasn't written by a doctor observing a patient. It was written by the patient herself. In 1811, the English novelist Frances Burney underwent a mastectomy without anesthesia after being diagnosed with breast cancer. Months later, she wrote an extraordinarily detailed private letter describing the entire experience. One of the most vivid, harrowing first-hand accounts of unanesthetized surgery that survives from this era, still studied and cited by medical historians today. She described seeing the glint of the surgical instruments through a thin cloth placed over her eyes. She described the procedure lasting long minutes that felt, in her own words, like it stretched on endlessly, and being conscious and aware for the entire thing, held in place by attendants, unable to move. She survived the surgery. She lived nearly 3 decades longer, into her 80s. Reading her actual words is genuinely one of the closest things we have to standing in that room ourselves. Not an archaeologist's inference from bone, not a second-hand medical record, but a first-hand human account of exactly what every other unnamed patient on this list almost certainly experienced too, in their own way, without ever having the chance to write it down. Here's the part of this story that's easy to rush past and genuinely shouldn't be. Every technique on this list, the restraint, the herbal sedation, the inhuman speed, the fire, existed because there was no way to fully eliminate the pain. Patients undergoing these procedures were, by any modern standard, enduring real trauma, physical and psychological, regardless of whether the surgery itself succeeded. Children underwent procedures like this too, held down by adults who loved them, with no better option to offer. Survivors likely carried the memory of what happened to them for the rest of their lives, in ways ancient and pre-modern medicine had no framework to even name, let alone treat. We tell this story with a sense of awe at human ingenuity, and that awe is genuinely earned. But it's worth sitting honestly, for just a moment, with what enduring that ingenuity actually felt like for the person strapped to the table. So back to that man. 7,000 years ago, lying on the ground while 4 people hold him down, a sharpened stone about to cut into his skull. He had no drug that could reliably erase what was about to happen. No guarantee of survival. Just restraint, maybe a crude sedative if his culture had access to one, and the steady hands of someone who had done this before and gotten fast enough at it to matter. And somehow, remarkably, impossibly often, it worked. The bone healed. He lived. Modern anesthesia as we know it, reliable, safe, genuinely pain-free, is barely 180 years old, first successfully demonstrated with ether in 1846. That's a blink of an eye compared to the thousands of years of surgery that came before it. Every time you go under for a routine procedure today, feeling nothing, remembering nothing, simply waking up on the other side of it, you're experiencing something that would have seemed like impossible magic to nearly every human who ever lived before you. They didn't have that. They pushed forward anyway.